after he speaks. We're dealing with a time issue, but so don't move, right? Okay, what you need? Go. Okay, my name is Melvin Foote. I'm the president of the Constituency for Africa, which is a Washington, D.C. based education and advocacy organization. And let me say, this is my second year here at the summit. And I'm happy to be here. I'm happy to work with Will Ngwa, who I think is absolutely a new age of a leader. He's intellectually sharp. He's linked into people. He's very much into collaborative mode. And it's a joy working with him in this summit. I've been asked to introduce John Nkengasong, who is the new director of the Africa Centers for Disease Control. John came to our conference last September in Washington, and we talked about a lot of the issues in Africa, and he represented the Centers for Disease Control. And he walked up to me later and said, "Oh, I just been named," because we've been lobbying and advocating that Africa needs to scale up in terms of their health. After Ebola, Africa needs to take charge of Africa. And I think Ambassador Eric Kana really outlined some of the challenges that Africa faced and what Africa is trying to do. So John said, I was appointed the new director of the Africa Centers for Disease Control. And he said, we're going to launch this thing next year, early next year, and I want you to come out to Addis Ababa for the launch of the Africa Centers for Disease Control. So I was invited. I was invited to go in March, where the Africa Centers for Disease Control was officially launched. And they have brought about 150 of the top health experts from around the continent. Every country was represented at the highest level. Everybody there had PhDs and MDs and ABCs, and I was just so intimidated being there with all these brilliant people, these scientists, and who were really laid out the framework for the Centers for Disease Control and really talk through the issues and talk through the collaborations. The diaspora is front and center. They're seeing the diaspora as being a critical component of this, both in providing technical assistance, providing resources, and many other ways of undergirding this new Center for Disease Control. So we're really honored, John Nkengasong is the right person to be leading the center. He's first of all brilliant, just brilliant all over the place, but he's also a personality-wise, who can get along with everybody. Everybody nobody questioned the fact that John is heading this thing. Everybody said, okay, he is the right person to do that. So, and without further ado, I'm really honored to present John Nkengasong live from Addis Ababa, who's going to brief us on the center, goals, the mission, and what's going to happen in the short term and what is going to happen in the long term. He's very much aware of who's here, and so I think this is a perfect kind of match using technology so that we can actually talk in real time with the real leader of the Africa Centers for Disease Control. So without further ado, John, the ball is in your court.
Thank you, Melvin. Can you hear me?
Yeah.
Can you? Okay, good, excellent. And thank you so much for the opportunity to speak to you about the Africa Centers for Disease Control and Prevention. And I would need help from that side to help move the slides forward. And if you are ready, I would just say slide and we can transition to the next slide. So I decided that I would title the talk the Africa Centers for Disease Control and Prevention, Augmenting Africa's Response to Health Threats. And next slide. I'm assuming that the slide you are seeing is a picture. Good, excellent. This slide shows you the roadmap for Africa's development that the African Union has established. And this was established about 2 or 3 years ago, and it was intended to be a 50 years agenda. And it's entitled The Africa We Want. And I really love it. It's really outward looking and extremely ambitious. Next slide. If you look at this slide, the document very carefully, in the health strategy, it has certain aspirations, which I summarize for you here in 5 bullets. It speaks to the fact that they want to strengthen surveillance systems in member states so that they can actually function. They want to control endemic diseases, including HIV, hepatitis, tuberculosis, and all the rest in member states. And they want to work on reducing the risk factors for non-communicable diseases so that they can decrease the impact over the years significantly. They want to have member states have pandemic preparedness and response plans that function 24/7 and 365 days a year. And lastly, they are taking the issues of antimicrobial resistance capacity in member states very, very seriously. Slide. So in the next 15 minutes or so, I would like to walk you through three different aspects. I'll be presenting it from the perspective that, and with the assumption that many people in the room are just beginning to get familiar with the Africa CDC, so I'll devote the first few slides to giving you the genesis of how the Africa CDC was established, and then I'll quickly discuss the role of the Africa CDC, how they want to position themselves in this space. And lastly, I would really like to speak on the role of the National Public Health Institutes in this new construct. Next slide. So, the Ebola outbreak taught Africa a series of lessons, but there were at least two very important lessons that emerged from the Ebola epidemic, which is that our health systems are extremely weak, very fragile, and then secondly, that the world as a whole was very poorly prepared to tackle pandemic diseases, despite the availability or the commitment to the international health regulation since it was launched in 2005. Next slide. For those of us who were privileged to take on the Ebola challenge in West Africa, we saw so many campaign boards, and one of those that drew my attention was this one, which read, "Ebola must go." And then very importantly, it states, "Stopping Ebola is everybody's business." Next slide. So I have modified that slide to read, "Pandemics must go, and stopping pandemics is everybody's business," which means all of you sitting in this conference today should be part of this very important and very challenging endeavor that the African Union has decided to take on to avoid the occurrences of pandemics. Next slide. So we from Africa CDC are seeing diseases in three dimensions. First, the African Union believes that diseases are a security threat for the continent. Second, they believe that it's a serious economic threat for the continent. And lastly, of course, that it continues to be a serious health and social threat on the continent. And I will not go into all of these numbers, but there are at least 4 different categories of threats that we are facing. The current emerging and emerging diseases, the antimicrobial resistance, which is projected to result in about 4 million deaths per year by the year 2050 in Africa if nothing is done. Injuries are becoming a huge public health issues, and the rising threats of non-communicable diseases. Slide. So this slide shows you a picture of Africa, how outbreaks have occurred over the years, starting from 1970 to 2016. And it suffices to look at the very right-hand side of the slide, which shows you that over the years, the number of red dots have increased in member states. And this is a clear indication that it's a question of time before one of these dots will become a major pandemic, just similar to what we observed for the Ebola outbreak. As we speak, as all of you probably know, or some of you who have read the literature just this week, that we are currently dealing with an outbreak in Liberia of unknown origin yet. So with a case fatality rate of 50%. So we are following that very seriously. So who knows which of these red dots has actually engineered the situation we are dealing with in Liberia this week. So we are taking this very, very seriously. Next slide. So in terms of national security threat, people have wondered what the relationship exists. These are pictures that were taken during the Ebola outbreak in West Africa. And you can see very easily how, because of a disease, a country's national security apparatus can go down very, very quickly, given the orders from the rioting pictures you saw on this slide, which is simply as a result of poor management of a pandemic or lack of preparedness to manage a serious pandemic like the Ebola outbreak. Next slide. In terms of economic, the impact of Ebola in West Africa was devastating. The economies, the World Bank projects that the West African countries had a huge loss of about $4 to $5 billion during the period that the Ebola crisis lasted. And this is, we've also seen this in other regions of the world where the SARS outbreak occurred in 2003 and in 2015. So this testifies to the fact that we need to take disease threats not just as a social and human health risk factors, but seriously as an economic factor. Next slide. So this slide shows you the population of Africa projected for the year 2050. So we are currently at 1.2 billion inhabitants, and by the year 2050, the population of the continent is projected to be about 2.9 billion. And this is significant because when WHO was established in 1947 to be very specific, the population of the entire continent was about 228 million inhabitants. So today, down the road, we are dealing with a continent that is projected to be up 2.9 million in less than 30 years from now. Next slide. And with this comes a lot of movement. And this is a slide that I pulled out from the internet that just shows you the major movements in Africa by airlines. But there is the major airlines that include Egypt Airlines, Ethiopia Airlines, South Africa, and one should add to this the Kenyan Airlines. It shows you significant movement of the people. So the population has increased, the movement across within Africa has increased and outside of Africa. So all of this speaks to the fact that the continent needs to be better prepared and more prepared to address disease threats. Slide. So let me now segue into the role of Africa CDC, given the background that I've just given you. Next slide. In 2013, at the African Union Summit in Abuja, this was a special summit that was convened to address issues related to HIV, tuberculosis, and malaria. The head of states started discussing the concept of establishing a continent-wide public health agency, given all the background that I just presented. Next slide. And fast forward, the Ebola epidemic hit the continent, and the ministers of health were called on to gather at the heart of the Ebola crisis to assemble in Equatorial Guinea and actually dream of accelerating the creation of the Africa CDC. Next slide. And in January 31st this year, the head of states gathered here in Addis Ababa during the annual summit to officially launch the Africa CDC. And the building on the left is the headquarters of the Africa CDC, where we are currently located. And I've showed this building and these pictures to highlight the uniqueness of the Africa CDC. First is location within the African Union provides an opportunity to really frame the discussion of what needs to be done to protect the continent's health in terms of security and economic impact. Secondly, for the first time, it brings a united voice for the entire continent. So as you all know, WHO Afro covers 47 countries, and WHO EMRO in the North Africa covers the rest of the countries. So with Africa CDC's mandate of covering the entire continent, this is a unique opportunity for all of us to make it what it has to be. Next slide. So the strategic plan was launched on March 24th, 25th, as Mervyn mentioned. I think it was a very successful launch with experts from all over the continent as well as across the globe, including partners like the World Bank, the African Development Bank, the US CDC, the European CDCs, and the WHOs. Next slide. So this is, as Martin Luther King would say, the time is always right to do the right thing. This is the time for us collectively to throw our weight behind the functioning of the Africa CDC. The head of states had the dream to launch a public health agency. The time is now for all of us to rally behind this vision and make CDC Africa what it ought to be. Next slide. So Article 5 of the Constitution of Africa CDC speaks of the African ownership that should add value and should be credible and should include regional centers. I think I just wanted to highlight this here to bring to your attention the African ownership aspect of this discussion. And I heard during the discussion that a lot of you advocating for the need to harness Africa's resources. So it speaks right to the concept of when the head of states launched this initiative that Africa should actually have its own agenda that drives public health. Next slide. So this slide shows you, as I know most of you will be wondering, what is the relationship with WHO? We've actually signed a memorandum of understanding between the Africa CDC through the AU and the WHO that outlines very clearly how the two organizations will work to address the huge challenges that we all face on the continent. So this partnership is strong, and we continue to have exchange visits. I will be in Brazzaville to visit with the WHO headquarters in June. And I think we have plans for them to second people to the Africa CDC in the next weeks or so to continue to help us as we establish. Next slide. So now, what is the mission of the Africa CDC? Our mission is to strengthen Africa's capacity and institutions to detect and respond to health threats through partnerships, science, policy, and data-driven interventions and programs. Next slide. Our operation model it will be based on this diagram. So the base and the pyramid of the base of the pyramid of the operation of Africa CDC will be the National Public Health Institutes. We will be advocating forcefully that each member state should have a strong and functional public health institute. And each of these institutes will work around the 5 regional collaborating centers, that is in Egypt, Gabon, Kenya, Nigeria, and Zambia. And the regional collaborating centers will all work closely in a network fashion with the secretariat in Addis Ababa. Next slide. And we have recently launched what we call the Regional Integrated Surveillance and Lab Network, RISNet, as a vehicle to make sure that the assets that are currently available in each of the regions are best used. Okay, for example, we see the RISNet as a vehicle to do cross-border surveillance. As you all know, or most of you are aware, there's a huge malaria outbreak in Southern Africa, where countries like Namibia, Angola are all involved, and we've dispatched people from Africa CDC to help with that. It will be a vehicle to address the issues related to antimicrobial resistance with a linkage to the regional collaborating centers and a pandemic preparedness plan. So this is a way to group the continent of about 55 member states into 5 regional blocks that can actually implement a public health programs. Next slide. This slide shows you the functional pillars of the Africa CDC, and there are 5 of them. One area of focus will be surveillance and disease intelligence. The second is information systems. The third is laboratory systems and network. The fourth is pandemic preparedness and response. And lastly, the public health research. The foundation of this, which we call enablers, are workforce development, innovative approaches to leapfrog certain public health concepts, partnerships, financing, leadership and management, and communication. Those will be the foundation that these pillars will be based on. Next slide. So let me walk you through very quickly, and I'll limit myself to the goals, and you can read the activities in each of these boxes here of each of these pillars. So under the surveillance and disease intelligence pillar, our goal is to strengthen health-related surveillance systems for improved public health decision-making and action. Next slide. Under the information system pillar, our goal will be to develop and strengthen innovative information systems that can support public health programs and surveillance. Here, we are actually looking at innovative approaches that we can implement at the community level, at the district and the national level that can link us from the time we detect events to the time we respond and analyze and respond to these events. So we're looking at innovative technologies that can be applied to address these gaps. Next slide. Our third pillar is to work with member states to strengthen laboratory systems and network. And we want to look at both clinical labs and public health labs and make sure that we create these networks that actually are related or connected within each regional collaborating centers. And each of these regional collaborating centers will be supported to develop advanced diagnostic capabilities. Next slide. Under pandemic preparedness, our goal is to support member states to have emergency preparedness and response plans. And we are currently working with WHO and the World Bank to establish what the frameworks will look like and address areas like hazard and multi-sectoral preparedness, risk communication, establishing a roster of rapid responders that can quickly move into an area when need arises, and work very closely with national and continental activities. We currently have a roster of about 800 rapid responders that were used during the Ebola crisis that we want to consolidate, strengthen, and actually expand that to each of the regions. Next slide. So the last area of focus is for us to strengthen public health research to improve public health decision making and practice. Next slide. So these are the cross-cutting enablers that I did mention, which include the workforce, the partnerships, innovation, financing, and leadership. Under financing, we really want our approach to be indigenous-driven in order to meet our requirement of an indigenous, an African-owned organization. So partnership with the private sector is key for our strategy. Next slide. So we need to work and leverage with other resources that are available on the continent. I mentioned here already the role WHO will play. We work very closely with WHO, but other organizations like the African Society for Lab Medicine and the African Epidemiology Network are organizations that we are already partnering with. So ASLM for the lab networks and AFINET for workforce development and surveillance. Next slide. So as I mentioned earlier, all partnerships are welcome. So you are all welcome to join us and identify areas that you can work with us. I think we want to have a very inclusive approach as we develop the Africa CDC. Next slide. Next slide. So let me just conclude with the role of National Public Health Institute, because it's the foundation of our activities. Next slide. We believe that for Africa CDC to be successful, each member state should have its National Public Health Institute that does 4 things. One is to support the laboratory networks and link them to surveillance systems in the country and care under the RISNet concept. Secondly, to have a multi-sectoral pandemic preparedness plan and response. So this pandemic preparedness plan should bring together the ministries of agriculture, defense, communication, interior, as well as finance. Thirdly, we need to have each member state have its own emergency operations center, which is the nucleus on which to coordinate pandemic preparedness responses. And lastly, to strengthen surveillance systems and disease intelligence within each member state. We want to bring the response closer to the country. Next slide. So in conclusion, slide. The opportunity is here for all of us. Let me end with this slide again, which is the slide, is a photo that that was taken at the launch of the 5-year strategic plan. So the ship has left the harbor. It's now time for all of us to join the ship. All of you there, you are welcome to join the Africa CDC ship, and let's make Africa CDC what it ought to be and fulfill the dreams of the head of state. Thank you so much.
Thank you very much, John. I think we have time for a few questions. Should we go directly to? Let's take a few questions for John. And Will, I don't know if you want to say something first, or are you okay? Okay. So if you have a question for John Nkengasong, you need to go to the mic. This is our time to the thing. And let's take 2 or 3 questions. Selma.
Were you able to hear the question?
One more time. Who's financing?
So the question was, who's financing the African CDC?
Oh, very good question. The member states are financing Africa CDC. The African Union has also agreed to set aside 0.5% of its operation budget to support Africa CDC. And of course, as I said earlier, we're also looking at working with the private sector to establish a financing analog that will require that the private sector also weighs in and help to support the funding of Africa CDC.
Okay.
Excellent lecture. My name is Sam Parker. I'm a psychiatrist. I previously asked this question back in September last year. How much attention will you give to mental health?
So the question was, how much attention will you give to mental health?
For now, I mean, that's a very good question. We have a plan that is developed for 5 years, and the first 5 years are the things that I mentioned. So we're taking it one. I mean, given that this is a new organization, there are so many other things that are not that we can address now. I mean, there are issues related to maternal child health, mental health, and others that we are not taking on at this point. So if I would be happy to share with you the org chart for the next 10 years, and you see that mental health and other aspects are well covered. But for now, given that we are starting from zero, those are the priorities that are listed for you. Over.
I'm Dr. Kennedy. I'm working in Nairobi, Kenya. I have a few questions. What I noticed from those pictures that when African leaders meet, pictures are good, the flowers in the background, this looks very neat. This includes the president, the ministers, and everybody. When you go back home, what you notice once you leave the airport is that there's a squealer and everything else that goes with carelessness. Now, the basics to me are these, and I think I went to school to learn this, that hygiene is number one. If you pretend that you are going to address all these nice things with the big budgets that are here, Africa should go back and address hygiene, because this is where the disease starts. It doesn't exist on the continent. We're told that infrastructure is not there. And if this were addressed, disease would also start coming down. And all this cannot be done if the population keeps growing without anybody caring about it. And I hope that this will be addressed so that we get better kind of results for what we claim that we are trying to do. Thank you.
So his comments were pretty much in regards to the need to address hygiene and infrastructure, and maybe you can just speak a little bit about how the 5-year strategic plan really looks to address those issues, if at all.
Yeah, under what I call the foundations or enablers, there's a whole workforce development strategy, which we are calling the Africa Public Health Core. That starts with the community. Okay, we recognize that we cannot be effective if at the community level, which is the base of the pyramid, we do not have a strong public health program, a community public health program. And that public health core program at the community level will hopefully address issues related to hygiene and be their first responders. So as I said earlier, we cannot address everything at this point. We are very, very focused on trying to do things that will establish the organization and can create an impact and actually begin to respond to what the threats are for now. But we recognize that, and we are hoping to use a multi-sectoral approach where if we train people at the community and establish the community programs, they can do a whole host of other things. But that's a very valid comment.
Next question.
My name is Julia Royal, and I thank you for your informative and substantial presentation. Much appreciated. Quick question. Do you have a specific strategy for engaging the ministers of finance? Ministers of health, of course, they're engaged, but ministers of finance who make those decisions that affect infrastructure. Do you have a strategy, or is there a plan to have a strategy?
So the question is, do you have a strategy to implement a program or projects that really encourage collaboration, including the ministers of finance?
Yes, absolutely. Very good question. As I said earlier, one of the unique advantages of having the Africa CDC within the African Union is the convening power of the AU to reach out to the ministries of finance as well as the ministries of defense and others. So we have one of our strategy, our activities is to really convene a meeting that we bring all these stakeholders or departments together. I mean, just this week I was at a meeting with the ministries of defense here in Addis Ababa, where we are looking at their role in pandemic preparedness, how to help us lift people from one region to another if pandemics will occur, and the logistics that they should stockpile for us for emergency. And these are the ministries of defense with generals, okay, all over. So this is unique for, and the first time that the health issue is being addressed by the ministries of defense. So we hope to take that discussion further and engage the ministries of finance from an economic perspective to begin to show them what the impact of one pandemic can result to their lack of growth, or for them to achieve their economic growth. So that's a key undertaking that we need to engage in. Just to let you know, the first week of May, I'll be presenting the Africa CDC at the World Economic Forum in Durban, and that is strictly a business forum, and that is again aligned with the concept of taking this whole concept to a different constituencies other than the ministries of health.
Wonderful.
John, we have time for 2 more quick questions, so I'm asking the presenters to be real succinct.
Yes, quite. When I was in medical school, I was taught that prevention is better than cure. CDC, I'm happy to say it's also Center for Disease Control and Prevention. There is no other. I'm happy there is prevention. Now, looking at Africa, what was happening in Europe in the 18th century is still happening there. Cholera is still there. Safe water, drinking water, is a rare commodity. How many cities in Africa can one go and just drink water from the tap? Are these areas that you're looking at? Because most of the things that we have in Africa, still, in addition to the double value of communicable disease, still preventable. And this center, I think, is a center that can help influence governments in Africa to look at this critical area of the health of its population.
Thank you. John, we're going to take the final question. This is from Dr. Julius Garvey, who you may know as the son of Marcus Garvey, the great Pan-African leader, who's a medical doctor, a surgeon in New York, but who's very much involved in the whole Pan-African diaspora movement, but very much involved in health development across the continent. So Dr. Julius Garvey.
Doesn't happen in the community, I would like to know what the plans are overall to develop community health workers, because this is where prevention takes place. This is where early detection of disease takes place. And I think that the CDC needs to have an overall plan to put in place in all 55 of the African countries. I'm wondering if you have such a plan. Thank you.
So the question was, how do you plan to engage and train community health workers as the true pillar to really focus on prevention at the most local level?
Oh, very excellent question. I think we have just a bit, probably that is going to be one of the very early activities that we will do. We have partners like AMREP, the African Medical Research Foundation in Kenya, and others that already have some models, some community training models that we want to review very carefully and implement. Now, the Africa CDC, I think it has to be clear, will implement its activity through partnerships. Okay, partnerships, regional partnerships with universities in the region, non-governmental organizations in the regions. So I think the community, there are certain tools that are out there that we need to review very carefully and start implementing using the RISNet approach there, so that they can actually have the skills to tackle the existing endemic diseases while preparing for the unknown. So I think we are not going to prepare people that will sit there and wait for disease outbreaks that are not yet there. So we are very cognizant of using a multi-cross-sectional approach to train the community healthcare workers. Over.
Thank you, John. On behalf of Harvard University and the Global Health Catalyst Summit, I want to thank you for taking time out of your valuable time out of your schedule to share with us the African Center for Disease Control and Prevention. Can you all stand and thank Dr. Nkengasong? John, you're getting a standing ovation.
Oh, thank you. So, thank you.
And with that, thank you very much, and I'll be involved with you soon. We're gonna be